Hi, I'm Dr. Marlene Freeman. I'm the editor-in-chief of the Journal of Clinical Psychiatry and the section editor on the Focus on Women's Mental Health section. I'm also a professor of psychiatry at Harvard Medical School and Massachusetts General Hospital. I'm really excited to talk to you today about postpartum obsessive-compulsive disorder and related conditions and some of the recent work that we've displayed in the Journal of Clinical Psychiatry. In general, for some background, when we talk about postpartum psychiatric disorders, we're really talking about an array of different topics. One is postpartum depression, which I think most healthcare providers are most familiar with. That's a depressive episode defined as perinatal depression in DSM-5 as onset in late pregnancy or within 1 month after delivery, although we hear about definitions that are much broader than that. Postpartum psychosis is a unique condition, usually occurs pretty rapidly in the postpartum, where women have a psychotic episode after childbirth, which is usually associated with a diagnosis bipolar 1 disorder. There are also special considerations for anxiety across pregnancy and the postpartum period, and we're, as a field, gaining more appreciation for postpartum anxiety and postpartum OCD in particular, which we'll discuss. When we talk about postpartum depression, though, one of the things that's most overlooked is that obsessions are extremely common. As we would define obsessions, intrusive, distressing thoughts that one can't stop having that are extremely distressing. One might have rituals or compulsions to go along with that. We have a separate diagnosis, OCD, but postpartum depression often has obsessions as part of the clinical picture, whether or not someone has the complete diagnosis of OCD or not. When we talk about postpartum anxiety disorders, someone can have an exacerbation of an existing anxiety disorder. They can have generalized anxiety. They can have OCD or obsessions plus rituals or compulsions. We're also gaining knowledge about postpartum PTSD. Today, we're going to focus on postpartum OCD. We've had some really exciting articles in the Journal of Clinical Psychiatry on this topic. One important paper that we published was on the perinatal timing of obsessive-compulsive disorder. In this paper by Fairbrother and colleagues, they reported on the timing of obsessive-compulsive disorder onset. The purpose was to characterize the onset of perinatal obsessive-compulsive disorder, and they used a prospective cohort of individuals followed in late pregnancy and at 2 time points postpartum. They followed almost 100 patients. Over 2/3 of participants whose symptoms met full criteria for OCD at some point in their most recent perinatal period reported perinatal disorder onset, meaning that during either pregnancy or postpartum was the first time that they ever had the full diagnosis of OCD. The majority of those, 74%, reported onset in the postpartum. So they reported that patients were at extreme risk of worsening or new onset OCD, more likely in the postpartum than during pregnancy, and recommended screening recommendations based on that finding as well. Also published a paper in 2022 looking at the question of whether obsessions of infant harm pose a risk. So, do obsessions of infant harm, which are very common, increase the risk of infant harm? This is a really important question because many women who are suffering from postpartum depression or anxiety share with their healthcare providers or experience recurrent distressing thoughts that they might harm their babies. They may have images or recurrent thoughts. They very often frighten the woman. Women often feel like they're going crazy or that they have postpartum psychosis and don't recognize these as obsessions. Often when they share these thoughts, if the healthcare provider is not well versed in postpartum psychiatric disorders, they may not know if this poses real harm or not to the infant. These investigators did a study looking at unwanted intrusive thoughts, so obsessions of intentional infant-related harm in postpartum mothers, and they looked at rates of infant harm or child abuse. What they found is that intrusive thoughts of infant harm was not associated with an increased risk of harming the baby. Overall, in their study, what they found among the individuals who participated were generally lower rates than the general population of child abuse or infant abuse, without any increased risk of intrusive thoughts of harming the baby associated with a higher risk of harming the baby compared to women who did not have those type of thoughts. Additionally, and more recently, in 2026, Beck et al. Published a paper in the Journal of Clinical Psychiatry called Unwanted Intrusive Thoughts of Infant-Related Sexual Harm, Prevalence and Assessment of Safety. This is a really important topic because many women do have intrusive, disturbing thoughts about harming their baby, and very often the context can take shape around sexual abuse of the baby. As you can imagine, this can be extremely frightening for patients if they experience this, and very often healthcare providers don't know how to interpret this. They looked at unwanted intrusive thoughts of intentional infant-related harm pertaining to sexual abuse. They looked at a prospective cohort of postpartum women, and they did interview assessments and looked at patients 7 weeks postpartum and 4 months postpartum. They specifically asked about sexual harming behaviors and thoughts. The behaviors were provided anonymously in a questionnaire, so were not linked back to any individual. They did that so that patients would share their information as freely as possible. They reported that unwanted intrusive thoughts of infant-related sexual harm were fairly common, about 9%, which I think may be surprising to a lot of readers. They did not find that these thoughts were associated with an increased risk of sexual abuse or sexual touching of the infant. In the entire cohort of the study that they did, they found that there was one case of an individual who inappropriately touched her baby, which was not related to intrusive thoughts of doing so. There are some important clinical takeaways from this study. One is that such thoughts are quite common. They're incredibly disturbing to the individual when a new mother has them, but they can be reassured that obsessive thoughts, including this type of thought, is not associated with an increased risk of harm. The take-home message for clinicians are that postpartum obsessions are very common. The context is often around harming the baby, although they don't represent an increased risk of harm. They're incredibly frightening for new mothers. They may be very hesitant or ashamed. They may not want to tell other individuals that they're having these type of thoughts. So it's really important, in my opinion, as healthcare providers that we ask about thoughts. We might say something to normalize it. Many postpartum women will have obsessive, intrusive, distressing thoughts. They may be scary. Are you having any of these? They're treatable. They're important to detect. And we want to make sure that people who experience these are not afraid to reach out for help. I really appreciate your attention to these important papers and this important subject. Thank you.